Good morning, everyone. Good morning, judges. Good morning, chairperson. Good morning, everyone. Myself, Dr SUBODH from Iris Super Specialty Eye Hospital, Ranchi. So we did a study of incidence, severity, and treatment outcome. So my study was a yes. My study was the incidence, severity, and treatment outcome of advanced retinopathy of prematurity in babies born with assisted reproductive technology. So, as we know, the ROP is a disease of retinal vascular and capillary proliferation affecting the premature baby, and India is currently facing an ROP epidemic as because the more of premature baby because of the ART. So we did this study. Our study was a retrospective observational study at IRIS from January 2018 to January 2022. We just followed the screening guideline. We took the babies born less than 200 gram, gestation is 34 weeks, or those babies 34 to 36 weeks with exposed to the factors as prolonged supplemental oxygen, respiratory distress, or blood transfusion. We have followed the international classification for ROP guidelines were used to record the stage of the disorder, location of zone, and signs. Plus spectrum disease. Data were analyzed with the gestational age, birth weight, systemic factors to ROP, and statistical analysis were performed using SPSS software. So this is one of the baby we got like in ART baby, just a zone half ROP. We treated this baby with the anti-VEGF injection followed by laser. That is a complete recovery ROP in this one. So we had 474 babies. Among them, 272 were natural conception and 202 were ART. The mean gestational age in conception was 32. Otherwise, in ART is 31, which was significant. And we saw that the ART had a lesser gestational age babies. Again, with the birth weight, also the ART baby has a lesser birth weight compared to the conception one. In ROP, we got 88 out of 237 in natural conception were 32%, but whereas then ART is a significantly high, 149 babies of ROP in 237 were significantly high. But among them, the aggressive ROP were 58, the 18 were in natural conception and 40 were in ART. So this is also a significantly high. And plus spectrum was also 50 out of 78 in this ART baby compared to this 28. So we can see that in ART, the spectrum plus spectrum were high, the high severity of ARPR were high. We treated them with the observation and with the following other conventional methods. So in the observation, in natural conception, 227 baby were recovered, but in ART babies were 86. So this again shows that the chances of treatment is required more in ART baby. Anti-VEGF injection, with only one baby has recovered with giving one anti-VEGF injection in natural conception, but otherwise in ART, two baby, but the baby it was not significant. Most of babies were treated with anti-VEGF with ROP laser, and the numbers required more in ART, 44 compared to 19 in natural conception. We did only ROP laser in 25 compared to 69 in ART babies. Again, surgery were required in ART babies, one baby. One infant need a repeated injection. One baby required ROP surgery, and one baby required augmented laser. That is also in ART babies. So these are the data. We can see that the type of pregnancy comparing this. So we can see there's a more of natural conception in the no ROP were in more in natural conception compared to the ART. Again, we can see in stage 3 there is a more baby, 72 in ART baby compared to 28. Again, AP ROP with hybrid, there was a 40 babies in ART compared to 18 babies in natural conception. And again, the plus spectrum were also high in ART baby. So again, we have correlated this data with the gestational age also. So we can see in subtotal less than 32 weeks babies, the more ROP, 120 out of 143 in ROP babies born with ART, whereas the 55 out of 106 in natural conception. Even we can see even more than 34 weeks babies, 6 babies had in ART baby had ROP compared to 9 babies out of 64 in natural conception babies. So again, this ROP in relation to the birth weight, we can see lesser babies born less than 1500 gram, 121 out of 147 in ART baby had ROP compared to 25 out of this. Again, with more than 200 gram, 2000 gram, out of 9 baby had ROP compared to 15 out of 89 in natural conception babies. So this is the data we have analyzed the risk factors. So we can see the common risk factor were mainly respiratory distress system, neonatal septicemia, neonatal hypoglycemia, anemia. But these risk factors were more significant when if we have compared with the ART babies. So in our study, we have reported a significant increase in incidence of ROP among ART babies, 73.8% group compared with the natural conception, 32%. Incidence of aggressive ROP and plus spectrum disease has also been a significantly higher among ART babies, 74 to 73 respectively, compared to the natural conception babies. So the difference of outcomes is because of the assisted conceptions have been postulated to be because of gametes are exposed to a variety of drugs physically manipulated and nurtured in a potential hazardous condition, perhaps placed in inappropriate uterine. In our studied cohort, combined anti-VEGF and delayed laser therapy at least 2 weeks after the initial injection resulted in satisfactory refractive and structural outcome for children at 6 months of age. So conclusion, the data presented here shows a significant association between ROP in babies born of ART. Moreover, number of babies requiring ROP treatment is also significantly high in ART group. Combined ROP laser and injection has shown the rapid regression. There has also higher incidence of reactivation of disease in ART group compared to the natural conception and confluent ROP laser. Confluent ROP laser is a gold standard therapy for the reactivated ROP babies. So based on our results, we propose an ROP screening should be done up to gestational age of 36 weeks and birth weight of 2500 gram for babies those born by ART. ROP babies born by ART should be followed up closely and should be treated aggressively, and post-treatment they need special attention to look for recurrence. Although we need more data and more prospective studies to support this. Thank you, sir.
I have to few point I have to say that the incidence is not increased, I believe, but the awareness and screening,
yes,
especially in the neonatologist, is increased. So increase the screening, so the incidence is automatically, the number of patient is increased. Number two, in one patient you have mentioned you had not done you have given only injection.
Yeah.
So why not the laser? I don't know.
See, actually, there are a lot of studies are coming. Yeah.
After injection, you have to. So there was any particular reason?
The one baby we have treated with this injection only, and it has recovered. One of the baby in a follow-up. Yeah, complete vascularization. We followed up till 56 weeks, and we saw that the vessels were growing, so we didn't do laser in that baby. In one baby in ART, we have given injection and we did laser, but again the recurrence were there. So we have repeated injection given in that baby, but later on giving one injection and follow-up, that the baby got recovered. But in other baby, we have re-augmented the laser and then recovered after that.
And the third thing is the ARC babies belongs to higher socio-economic group. Okay. And the normal, I believe they are below the socio-economic groups. So they go more to the neonatologist, they do get admitted and might be detected. So this can be a major factor for the difference in the incidence of this ROP in
that may be one reason. One other reason also that the ART babies are prematurely they get delivered. They don't wait for 38-39 weeks to do for the delivery. Just they wanted the precious baby, so they usually they do this cesarean at 34-35 weeks, and sometimes they prematurely they get delivered also.
Okay, nice.
Yes,
I had one child at 32 weeks, not ART, who present with the NVI. So have you had any patients who develop severe NVI and posterior zone 1
we have
disease?
A lot of babies who were aggressive AROP. We got the NVI in the same. We get NVI commonly,
And it regresses.
But after giving injection, the NVI goes.
They regress. Which is the anti-VEGF you use?
We have mainly treated with the Avastin only. Sometimes some of the babies were the Razumab, some of the babies with the Centrix also, but most of the babies were treated with Avastin.
Dr. SUBODH, you have, I think, watched few babies till 56 PMA. So, and few you have lasered within 2 weeks. So, is there any specific guidelines?
Sir, actually, we have seen the other study that the if you give injection followed by after 1 week or within a 2 week they do laser. So what we have done, we have waited for at least 2 weeks. Minimum gap we have given 2 weeks giving injection followed by laser. So the minimum waiting period was 2 weeks, followed by we have waited till that we can see the recovery is going on. Then once we can see that the baby has already reached to 37, 38, 39 weeks and the vessels are not progressing, so we did laser in those babies. Thank you, sir. Thank you.